This is Rob Kilmer. The national conversation about health care reform is everything we have come to expect in America. In other words, a national embarrassment. That's what we're talking about this week on You Defend It. Welcome to You Defend It with Rob Kilmer. The phone number to call into the show is 772-1290, and that's area code 607. As always, callers to the show will need to take a position, be able to defend it with an argument that is factual, not emotional, and if you can't make your point without insulting someone, you can't make your point on this show. Callers and guests on this show are going to be treated with complete respect. For my part, I will ask questions that matter and give people the opportunity to answer. My website is www.youdefendit.com. That's youdefendit.com. You can give me your comments on the show anytime. By Friday of each week, I will have the topic up for the next show. You can also visit my blog through the site. You can read my posts and leave your own. You can always listen to my show live on streaming audio on www.wnbf.com. And my show is then uploaded to youdefendit.com later on Saturdays, and you can listen to it from there if you missed it live. Finally, there is a new debate suggestions section on my webpage. It is at the top of the homepage. Leave me your thoughts on topics, debaters, and questions. Okay. I was out of town for most of the week, and I did not read a newspaper or watch a television while I was out of town, or look at the internet to see what the news was. So, yesterday afternoon, when I came back, the only thing I could really find that was consistent, that was a story on almost every news outlet, was the debate over health care reform. But the story wasn't about any substantive arguments being raised in support or opposition. Rather, it was about the conduct of the debate itself. I will read from 2 articles about it, and then we'll talk about it. This is from the New York Times, dated yesterday. Health debate turns hostile at town hall meetings. The bitter divisions over an overhaul of the healthcare system have exploded at town hall-style meetings over the last few days, as members of Congress have been shouted down, hanged in effigy, and taunted by crowds. In several cities, noisy demonstrations have led to fistfights, arrests, and hospitalizations. Democrats have said the protesters are being organized by conservative lobbying groups like Freedom Works. Republicans respond that the protests are an organic response to the Obama administration's health care restructuring proposals. There is no dispute, however, that most of the shouting and mocking is from opponents of those plans. Many of those opponents have been encouraged to attend by conservative commentators and websites. "Become part of the mob," said a banner posted Friday on the website of talk show host Sean Hannity. "Attend an Obamacare town hall near you." The exhortations do not advocate violence, but some urge opponents to be disruptive. "Pack the hall," said a strategy memo circulated by the website Tea Party Patriots that instructed, "Yell out and challenge the representative's statements early. Get him off his prepared script and agenda," the memo continued. "Stand up and shout, and sit back down." The memo was obtained by the liberal website Think Progress. Its author, Robert McGough, a founder of the conservative website Right Principles, confirmed to the New York Times that the memo was legitimate. In response, liberal groups and the White House have also started sending supporters instructions and countering what they say are the organized disruptions. A volatile mix has resulted. In Melville, Missouri, St. Louis County police officers arrested 6 people on Thursday evening, some on assault charges, outside a health care and aging forum organized by Representative Russ Carnahan, a Democrat. That same day in Romulus, Michigan, Representative John D. Dingell, a long-serving Democrat, was shouted down at a healthcare meeting by a rowdy crowd of foes of healthcare overhaul, many crying, "Shame on you." In a statement Friday, Mr. Dingell, 83, deplored those trying to demagogue the discussion, but said he would not be deterred. On Thursday, talk show host Rush Limbaugh said the administration's healthcare logo was itself similar to a Nazi symbol. "If you get hit, we will punch back twice as hard," said Jim Messina, the Deputy White House Chief of Staff, according to an official who attended a meeting where strategy was discussed. One of the most raucous encounters occurred Thursday in Tampa, Florida, where roughly 1,500 people attended a forum held by Democratic lawmakers, including Representative Kathy Castor. When the auditorium at the Children's Board of Hillsborough County reached capacity and organizers had to close the doors, the scene descended into violence. Some of the protesters told local reporters they had been urged to come by a local activist group promoted by the conservative radio and television host Glenn Beck. Others said they had received email messages from the Hillsborough County Republican Party that urged people to speak out against the plan and offered talking points. Last week, a protester hanged an effigy of Representative Frank Crotoville Jr., Democrat of Maryland, at a rally opposing health care change. This week, Representative Brad Miller, Democrat of North Carolina, said he received a death threat about his support for the plan. Okay, that's from the Times yesterday. I have one other brief article from the Miami Herald that I will read from, also from yesterday. Representative Emanuel Cleaver will hold his monthly Coffee with Cleaver Saturday morning, and the Missouri Democrat, a Methodist minister, is praying for the best. He's expecting the worst, however, based on what's been happening around the country as the debate over overhauling the nation's health care system grows increasingly bitter and divisive. President Obama has underestimated the free fall the nation had already taken in partisan hostility when he talked about bringing change to Washington, said Cleaver, who supports reform. It has gotten worse. There is something at play here that is indescribable. From Connecticut to California, angry demonstrators opposed to health care reform have disrupted recent town hall meetings held by congressional Democrats. They attack lawmakers for backing a socialist agenda, shout questions without waiting for answers, and repeat disinformation as fact, in some cases even accusing Democrats of favoring mandatory euthanasia for senior citizens. On Friday, a Democratic lawmaker from Washington State received a faxed death threat a day after he described angry town hall demonstrators as a lynch mob. Representative Brian Baird of Washington, who supports President Barack Obama's push to overhaul the health care system, said that he also received threatening phone calls. He canceled the rest of the town halls he'd scheduled during Congress's August recess. A few Democratic congressional offices have also received threats connected to the health care debate. The U.S. Capitol Police has advised all of them to cancel their town hall meetings. Okay, that is just a brief, and that's just first two sites I decided to print. They're all essentially saying the same thing, that this is what's going on at these town hall meetings held by Democrats to discuss the health care reform. When we get back, we're going to take a quick break. We're going to talk about what's missing from the debate and why this is really just so typical of everything we've seen so far. And it's really what's not there that's so important. And what's going on right now is a scene that plays itself out over and over on every issue this country attempts to discuss. And when we get back, we'll talk about how I think it should be. We will be right back. You are listening to You Defend It with Rob Kilmer right here on News Radio 1290 WMBF Binghamton. Welcome back to You Defend It with Rob Kilmer. The phone number to call into the show is 607-772-1290. I want to give you 3 talking points raised at these meetings and also quotes from public officials that have been checked for their veracity by PolitiFacts.com, which is a nonpartisan fact-checking website. The first is House Minority Leader John Boehner's statement that the Democrat-backed health care reform plan will require Americans to subsidize abortion with their hard-earned tax dollars. This was determined to be false because of an amendment that would prohibit the use of funds for abortion. The Liberty Counsel, whatever that is, put out this statement. Page 992 of the health care bill will establish school-based health clinics. Your children will be indoctrinated and your grandchildren may be aborted. There is nothing like that in the bill. According to PolitiFacts.com, completely false. The Conservative Club for Growth put this out. The health care reform plan would set limits similar to the socialized system in Britain, where people are allowed to die if their treatment would cost more than $22,000. This was determined to be false. There is no proposal in the bill that puts a price on life or total cost of treatment or anything like that. Okay. You know what's missing from these debates, from these protests, from these town hall meetings? Alternatives. Where are the Republican town hall meetings where alternatives are proposed and discussed? Where are those meetings? I can't seem to find them. I keep looking, but I don't find them. I see Republican town hall meetings where the Obama plan is ridiculed. I don't see an alternative. This isn't a debate we're engaging in right now. This is a 50-state fight night. And my question is, towards what end? Simply defeating something that reforms a system we all agree is broken without a sincere alternative is really just an all-out effort to keep things exactly the way they are now. An engaged public, if the public were truly engaged on this, would regard this as laughable, would regard this as abrogating your duty. But we aren't an engaged public. We choose entertainment over substance. All right, I'm going to go to Frank from Appalachian. You there?
Yes, I am, Mr. Kilmer.
Good morning, Frank. How are you?
I have some duct tape sitting right next to my chair here, so I can wrap it around my head because I think it's going to explode. I have some really strong feelings about this health care bill because I have to use it all the time. And this is, I think you are violating your own rules, the Kilmer Doctrine, because you started out, you enumerated all the bad things about the opponents of the health care bill and not the good things about the plan. So
my point is there aren't any alternatives being offered. If there were sincere alternatives being offered, we'd talk about them.
I've heard about it, but let's talk about what you said first, okay?
Sure.
Okay. Now, here's the substantive issues. The latest Rasmussen poll taken yesterday, or given yesterday, was 68% of the American people rate their health plans as good or excellent. Okay? There's no one health care plan. I heard Obama asked a question about the health care plan. He couldn't answer it. He didn't know what was in it. He didn't read it. There's 2 plans right now. There's the House plan and the Senate bill. And there are things that, I have tried to find out about it. None of them covers 100% of the people. 17 million people are going to be excluded by the Senate bill, and I think it's 36 million by the House bill. So it isn't even universal health care.
Well, then my question right there would be, what is the Republican alternative that would cover those 17 and 36 million, respectively?
I don't know if we want to cover them all.
Right.
I know a lot of young people who think they're invincible, and they don't want to pay into a plan. They want no plan right now. They don't want to pay in anything, even if it was a cheap plan. I know them personally because they're relatives.
Okay.
Let me tell you.
You have invincible relatives?
Pardon me?
You have invincible relatives?
The ones that are like 21 and 25, yeah, that's the way they feel. That's typical of young people. I know I felt that way when I was that age. Oh, you mentioned this thing about the Rush Limbaugh and the Nazis. You know who started this stuff? Nancy Pelosi. She started this brouhaha when she said that many people at the town hall meetings, and the pictures I've seen of those people are mainly senior citizens. She said they were wearing Nazi symbols. But when asked about it, she didn't say who they were. And you mean to tell me the press wouldn't put those pictures all over the map? I just don't believe it. The Democrats' own CBO said that this plan is going to cost $1 trillion, and the present, Obama spending was unsustainable. How can we do any kind of a plan now? I say, yeah. When the Congress was asked, hey, why don't you guys get this plan too? Oh no, we don't want this plan. We got our own plan. So I don't know. This thing really makes me angry. It really makes me angry. And I think what you're seeing out there is you're seeing average senior citizens standing up at these meetings and saying, hey, we don't want this plan. Come up with a plan and debate it for 6 months or a year, and, let all sides see what the plan is in the first place. I don't think there is a plan right now.
Hey, I support debating it. In fact, one of the reasons that I chose the article I chose, the first one, was because it contains a section where they talk about the White House's response, which is, instructing people to send their own supporters. The whole thing's a joke. That's my point. When you got the White House, and when you've got both sides of this basically scripting how best to conduct these ludicrous town hall meetings, how to respond when you're attacked, and how to, this tactic and that tactic. We have everything but an actual debate going on with competing plans.
I'll tell you, I like these old people standing up at the town hall meetings. If they had one locally, I'd go in there and ask pointed questions too. I mean, people are just fed up. They're fed up with both parties.
But they're not going to. The elderly aren't going to lose under anything that's proposed. Nobody's talking about replacing Medicare.
People don't trust either party anymore. I don't trust either party anymore. Are you kidding me? We're
Neither
not going to lose
I.
anything. We're going to lose our lives. You want mandatory end-of-life counseling? I don't want mandatory anything by the government. I mean, I think this stinks. Look at the proposals in there.
I don't disagree with you. I mean, if you're going to call the show and talk about specific provisions you don't like, that's what I want to hear. That's what is not going on at these meetings.
That's what I don't like. I mean, I don't want mandatory anything by the government. I'm fed up with the government in my life.
A perfectly legitimate position to take. But what's going on at these town hall meetings is, it's a disgrace. We have the focus now is on how best to attack the opponent at the town hall meetings. That's what the media coverage is. That's what the debate about health care is in this country right now. That's what it's been reduced to.
Here's the bottom line for me. Come out with the plan, debate it for a year. Cut out this stuff about, we got to push this thing through. I mean, look at the stupid stimulus bill that went through.
I agree 100%. But let's have an honest debate with alternatives.
I agree with that. I think the Republicans ought to put out a bill. I don't even know who's leading the party right now. I think both sides stink. That's what I think.
Well, Frank,
you can see I'm just fed up too.
I appreciate your call as always.
Okay.
Thanks for calling. Okay. I've got. Well, you know what? We're going to take a break. We would ordinarily, I should say, take a break at 8:30. I got a couple more I want to get to. Joe from Binghamton, you there?
Yes. How are you this morning, Mr.
Good.
Kilmer?
How are you?
Good. The reason why I'm calling is I have a few issues with this healthcare debate. One is that the government is always mismanaging things. Now, they're doing things with Medicaid alone that are ridiculous. My mother, for example, she's on SSI, and my dad is as well. He had open heart surgery a few months back, and now because they're both on this, she is not getting Medicaid at all, and here she really needs it. And it's things like this that are going to overflow right into this health care bill. What they need to do is scale down the government and maybe turn this more over into the private sector. But it should be based on what people's incomes are, and everybody should be expected that they're going to have to pay something for this. There's no getting around it because it is going to cost a lot of money. And just base it on people's income, and that way there's cash flow coming into this without the government just raising our taxes. That way we know this money is going to be going for the health care plan. Because another thing with the health care plan itself is that there's doctors and things that are saying, well, look, we don't want to be involved because we're not going to make all the money. Talks about, well, okay, there's not going to be improvements in the medical field because the doctors aren't getting enough money. There's all kinds of issues like this that should be being addressed.
Well,
the government just jumps in and says, oh, we're going to put this health care plan together.
I agree that every issue related to this should be addressed, and I think it should be debated, and I think the debate should take as long as it takes. What I don't agree with is, and I'm not referring to you, but the approach in general of simply opposing what's out there. Everybody acknowledges we have a problem, and there's a plan out there, and to be honest with you, it's impossible to know what the plan is. I don't know what the plan is. I think Frank was right. I believe there are at least two, but come up with alternatives. If there's a problem with the plan as you see it, what is your alternative? If you take the approach, as I think we should, that this problem has to be resolved, it is not enough to simply oppose it. The plan that's out there now, you have to come up with a solution on your own. If you're in Congress, if you're the other party, if you can't just oppose what's out there without putting up something of your own.
Right, but one of the biggest problems with this is that the government does things without us having a say in the matter.
That is true sometimes.
What we need to do some way is gather people together and say, look, we're sick and tired of the government thinking we work for them. No, it's the other way around. They're supposed to be working for us.
Then I got to go to the next call, but my view is then we got to make both sides work. And work means coming up with a solution, not simply opposing. Thanks for calling.
All right, thank you.
Take care. All right, I'm going to try and get one more here before the break. Bob, you there?
Yes, I am. Good morning.
Morning.
Well, I think you're right. I think there is a problem, and it revolves around essentially two issues, cost and coverage. And in terms of the cost, in terms of coverage, and let me put it this way. Every state in this union has Medicaid. Every single state. It's absolutely unnecessary to bump it up to the federal level. If you want to impact the cost, what you do is you say you have to use private physicians. You can't go to the ER when you have a cold. But if you keep it on the state level, there is more control for the populace in terms of whatever the coverage is. It's a lesser level. So there would be a little bit more control. I think, is it Fred or Frank? It's absolutely right. There's no trust in the government when you have people voting on bills that they haven't read.
Right.
And
Frank makes that point a lot, and Frank is right about it.
And trying to have an honest debate begins with that you have to have honest facts. And the honest facts aren't put out there.
I agree.
But my point is this. There is universal health care coverage. That's called Medicaid. And the expectation that you have to spend some money if you're over the limits, fine. You can do one of two things. Pay the money or work legislatively to lower the cutoffs. But it's there. It's there on a state level. There's no need to bump it up to the feds. They don't run anything well, whether that's Social Security, whether it's the VA system. Nothing they do is done correctly. So to trust them to run a national health insurance, whatever they put in there. And believe me, they're going to put junk in there when the final bill is put together. And no, I don't want my tax dollar going to partial birth abortion. And it's not right to mandate that happens.
I don't believe that that's in there. That's my point. I believe that that's being put out there when, in fact, it's not in the bill, in either bill.
Well, you have two bills. They're still in debate. I can almost guarantee you it will end up in there because of who we have as politicians. Almost guarantee that this will be presented that way.
Well, I think you'll find, Obama tends to disappoint a lot of Democrats. Right now, my understanding from what I read yesterday and this morning is that he has reached a tentative agreement with drug companies not to negotiate their prices.
Yeah.
I would find that astounding. And if he does that, he's going to lose a lot of support on the left, and I think it shows that he's a little unpredictable when it comes to this stuff.
I think he would make a great used car salesman because of his lovely smile. And
he would?
Yes, and his smooth talk. I don't believe that he's a good president, and I don't believe a word that comes out of his mouth. And when I hear him personally talking about health care and adding into his sentence about health care a productive member of society, you've got a problem. Then you're talking about two classes of potential victims. One is the newborn, and the other is the elderly. And he has used those words in relationship to a conversation about health care.
And you believe it's his intent to exclude from coverage?
Not exclude, but when you talk about cost containment, whether you go back 30 years to the DRGs and utilization review, automatically you start cutting coverage when you talk about cost. And he's already, I believe he's already identified the classes of people that he is going to whittle away at expenditures, the elderly and the fetus.
Okay.
And I think that comes from his own mouth.
Okay, well, thanks for calling in.
Okay.
Take care. Okay, we are going to take a quick break for local news and be right back after that. You are listening to You Defend It with Rob Kilmer right here on News Radio 1290, WNBF, Binghamton. Welcome back to You Defend It with Rob Kilmer. The phone number to call into the show is 607-772-1290. I want to be clear about my complaint here. And it's not just that there's no alternatives being offered. It's the debate itself, or what passes as debate. When you have the White House sending supporters instructions for countering certain people at these town hall meetings, the only instruction the White House should be giving is demand an alternative, not engaging in this idiotic scene that plays out at all of these town hall meetings. They're just as bad as the people who are disrupting them. On the whole, we know we have an enormous problem in this country with health care. It squeezed the life out of GM. It affects careers. It affects municipalities. 75% of people who file bankruptcy over medical bills have health insurance. We have a massive problem. With no debate in sight. We have an idiotic, shout fest at these town hall meetings. We have plans out there, at least two of them, to which the other side responds with ridicule and talking points, but no alternative. The mindset here, in my view, has to be, we're not leaving till the problem is solved. If you don't have your own solution, then get out of the way. And how could you not have your own solution? When you're in Congress, when everybody recognizes the magnitude of the problem, how on earth could you not have your own solution? What is it? Where is it? Where are the competing Republican town hall meetings where people say, no, this is what we should be doing? It's always easy to oppose. Anybody can oppose. Actually solving problems is not easy. And this problem has been intractable forever. You know, at least it's on the radar screen. I guess that's the silver lining. There's a discussion of it, regardless of how juvenile it is. But in this country, we should be demanding more. The public should be demanding more. They should be demanding an honest debate with 2 alternatives, 3 alternatives, 50 alternatives. Is this not a big enough problem yet to have encouraged people to formulate their solutions to it? Can you really be a national office holder right now and be unaware of this problem or not have put some thought into what you think the solution is? Okay. I don't know if I will have time to get to everybody. I will try. Lucas from Binghamton, are you there?
Yes, I am.
Welcome.
All right. Now, I've been talking in the past that there are solutions and all that. I went over the immigration thing in the past, so I'm not going to belabor that. The other one that has been proposed over time, and generally the Democrats have successfully blocked that when Republicans ever brought it up, is tort reform. Now, the thing is, you can say, if we adopt a loser pay system like they have in some countries in Europe and other things where you limit the jackpot justice system that allowed people to call it, where someone will sue because, let's say, a doctor made the wrong diagnosis and they look to make millions of dollars off of legal settlements and all that. You could propose that, although you could argue one of the problems with the European system is it allows incompetent or even criminal doctors to basically skate by, because I'll take one example where you had this doctor in Britain who was convicted of murdering 6 of his patients deliberately by basically poisoning them to death simply because they were getting elderly, but they had no other problems. They were simply old. And he poisoned. And the thing is while he was convicted of 6, he's suspected of 200 prior murders, which were simply too old for the government to make the effort to do it. And also, the British government does play games in trying to hide what the real murder rate in Britain is.
Let me. First of all, do you have a radio on in the background there or behind you?
No, I think I'm getting a little feedback. It's probably a bad connection. Okay.
Secondly, as far as the current debate underway in America on the American healthcare system, and I'm not aware of tort reform being a major issue in that debate, and maybe you're saying it should be. But what are your thoughts on the current debate?
Well, on one problem, you have the Democrats are getting upset that the tactics they have been using on the Republicans for a couple decades are now being turned back on them, because instead of, let's say, like when Maurice Hinchey has his little meetings here where he has in his county office building, and he basically has Democratic Party regulars and they turn up on an afternoon when everyone's still at work or something. And so basically it's his own people that are there, and he has a very friendly crowd that doesn't challenge him on any of the points or any issue that happens to be coming up at that time. In other words, he basically makes a speech, everyone applauds politely, and every question is a friendly one, which he probably already has a stock answer for.
Well, and so what you're saying, I think, is that, there isn't a sincere, an honest debate there. There isn't a meeting at which he's asked legitimate questions, and
Mm-hmm.
I agree.
a lot of the people that would vote that disagree with Hinchy are people who generally work during the day, and if you do not have something like, let's say, you don't have an announcement on WNBF News a few days before the event that Maurice Hinchy will be having a town hall meeting. It's going to be in the county office building next Tuesday or something like that. So someone could decide, okay, I'm going to make time so I can be there because I have some questions for Maurice Hinchy.
All right, you know what? I got to get on to another call, but
okay.
I have 3 more. Thanks for calling.
Right, bye.
Bye. Dan from Binghamton, you there?
Yes.
Welcome to the show.
Oh, yeah, thank you. Yeah, I want to basically say what the last caller kind of hinted at is what the problem is because the Democrats control the Congress and the presidency, they're more or less excluding the Republicans from offering any alternatives or anything of that nature.
Are you aware of a Republican plan, a comprehensive plan by the Republican Party to address health care reform in the United States?
Not specifically. I haven't. I listen to the news and everything, and I haven't really heard what they're offering. But I think like I said, it's who's in control of the government at the time. I guess they've actually been excluded from going to some of the Democratic meetings for discussing health care.
Well, and I'm not talking about the legislative process. I'm talking about in public. What is the plan that the Republicans are offering to the public? And I mean, I'm not aware of one. I'm not aware of a plan that the Republicans have where they are saying, and the Democrats won't even consider this, won't even let this come to the floor for a vote. I'm not aware of anything. All I hear is socialized medicine and talking point after talking point after talking point without a solution in sight. And for reasons that escape me, the White House, seems as interested in these absurd town hall meetings and the tactical way to approach them as the White House is in actually resolving the health care issue. I don't see either side making a sincere effort to do anything. It looks as if the Democrats can't agree amongst themselves between the House and the Senate on how it should be resolved, and the Republicans aren't offering anything. And it is amazing to me, but typical at the same time, that this is what America is when it comes to an issue of any issue, but an issue of this importance. Everybody has to deal with health insurance and the costs of health care, and this is what we have. When we are actually debating reforming it, this is what we do as a nation. We look for, we want a boxing match. We want pro wrestling, I should say. Boxing is a little more legitimate than what's going on. We want pro wrestling. That's what we'd rather watch than an actual debate with substance and competing plans where the pros and cons are debated, and then there's a vote. I don't know as a nation if we're even capable of it anymore. And that's where I see, or what I see when I look at this healthcare debate right now. I got 3 more to try and get to before the end of the show. Thanks for calling in.
Yep.
Okay. I think I have Jim from Hillcrest. You there?
Yes.
Thanks for calling in.
Thank you. I agree with what you're saying there. The health insurance is a disaster, and there is no debating it because I don't know if anybody brought this up, but to ensure our health from the beginning, like the FDA and the AMA are in cahoots, I think. For decades, the FDA is supposed to be a government watchdog, and they're allowing all this bad stuff in our foods, including...
Well, when it comes to, and the AMA in particular, when it comes to healthcare, and what I say, I don't know how often you listen to the show, but what I say every time I talk about healthcare is nobody talks about cost. There's nothing in this. Where is the debate about cost? It's what I call on this show the $300 apple. We've allowed ourselves to believe that we should be paying $300 for an apple without, and then we have a debate over how we should pay for it, how we should divide up that cost, rather than determining why it costs $300, and that's where the debate should start. Well, we don't have anything like that.
Well, I'm starting from taking care of yourself, because I think what's going to be happening is this is a big jump on getting more people on prescription drugs, because the FDA has scorned vitamins and herbs and all this, because if it kills one person, it's bad, where they're killing a lot of people and getting them hooked. You know, they're supposed to be a government watchdog, the FDA, and they're not, you know, telling us, hey, this is bad, this is bad, this is bad, but vitamins and herbs are good, or you shouldn't be allowed on the market, this and that, for decades, and you know what I mean? And then all these people are sick, they have diabetes and heart problems and all this, and they don't want to truly, I've been to the doctors a lot, they don't want to truly help you, they just want to get you coming in and out through a revolving door and get you hooked on prescription drugs. And I think this is that's what I think it's going toward. There's no debating it, because Big Brother rules with an iron fist now, is what I'm, you know,
okay.
Like George Bush did what he did. I'm not Republican or a Democrat. I'm just a in-between truth seeker type of person.
You're just Jim from Hillcrest.
Yeah. You know?
Well, thanks for calling in. I got a couple more I want to try and get to.
Okay.
All right. Thanks. All right. I'm going to attempt Brian on a cell phone in Philadelphia, or near Philadelphia.
Yeah, thanks. I'm actually driving up to Rochester today, and I'm on I-81, so I'll make it brief. I just want to make one point. I'm enjoying the debate as I'm driving along, but, you know, one thought you had that you say that opponents really need to come up with an alternative to sort of be justified. I'm thinking back to the Social Security debate, and, you know, President Bush at the time was trying to promote a new policy to fix what everybody agrees is an extremely broken problem or issue with the country.
Right.
Probably even more so, you know, more broken, and everyone agrees to it universally, than health care.
Right. And what did the Democrats offer?
Well, at the time they didn't offer anything.
Right.
But I guess what I'm hearing you say is
that's my point.
Well, but look at. I think looking back, I was sort of in favor of it. Right now, with the way the market's gone, stock market, you know, you kind of question, would that have been a good thing? I think it would have. It was appropriate at the time, because there were a lot of questions, to go ahead and say, hey, I oppose this. I don't have another alternative, but I think this is wrong. And I don't think people were lacking necessarily, or not justified, just because they didn't have a good alternative at the time. I think people can criticize this. I don't think they need to have something in their back pocket immediately. We're in the worst recession that we've had in 70 years in this country. It's not necessarily the time to put on a huge new spending bill, especially with all the government bailouts going on. There's going to be a lot of new taxes as it is. I don't think it's necessarily a bad idea to say, hey, I'm opposed to this. I don't have an alternative at this time, but now's not the time for this.
Okay. Well, thanks very much for calling in.
You're welcome. Thanks.
Yep. All right. Charles from Binghamton, you there?
Yes. Hey, my argument is that the FDA is in bed with Big Pharma, and they...
Well, let me ask you this, and I know you're the second person to say this. How does the relationship between the pharmaceutical companies and the FDA...
Due to the appointees and the political connections with big their lobbyists in Washington, they have connections with...
Do you believe that somehow prevents health care reform?
No, that's only one part of the problem. The other problem is that government itself shouldn't be involved in health care at all. But if it's at all involved, it should be at the state level, if anything. But I feel government job is to protect the public from, bad products and stuff like that. I mean, there's a legitimate reason for having government inspect certain things, but we're being force-fed monosodium glutamate in our food, which is very detrimental to your brain cells. Fluoride in the water, which is very detrimental to your brain cells. I mean, there's a lot of things going on that the FDA is just turning the other way or promoting. and it's total corruption at the federal level. And I feel we don't need any more. We don't need any more federal government involvement in medical things at all. But I think if people took their own health seriously and got on to vitamins and nutrition to help their own immune system, we wouldn't have the hospitals crowded with people with cancer, heart disease, diabetes.
Okay.
I mean, there's just so much corruption in government and so much political control over the medical industry that if you just get government out of the way entirely, I mean, it's just outrageous that people buy into this thing. The government has to take care of them from cradle to grave.
Okay.
If people just took their own health seriously, they wouldn't have the problems that they have.
Well, thanks for calling in.
Okay. Thank you.
Okay. Now, you may find this a little shocking, but it's surprising to me that two people have called in today and made what I would have considered prior to today to be an obscure point, that we need to address the relationship between the FDA, or the failures within the FDA, as it relates to the pharmaceutical companies, and put more of an emphasis on good health and vitamins and things of that nature. I mean, I find it interesting that two people have made that point. And I would not have expected that to come up twice, and it has. And maybe that's worth looking at. Maybe that should be part of the debate. Well, who am I to say maybe? It should be part of the debate. But I think that's an interesting point that two people have, or it's interesting in and of itself that two people have raised that today. Perhaps there should be more of an emphasis on health and less on, I guess, preventative health, or preventative measures than on treatment. All right, I'm going to try Ron, if you're there.
Yes, I am.
You got about 45 seconds.
Okay, you got a third one on the preventative measures. Tort reform, I've heard in the conservative area is a point to consider. Health care accounts from the beginning when a person starts working, tax-free health accounts. High-tech investment in medical products by investment and tax breaks. Stop illegal health care and increase the education for people that are willing to be in-home health care providers. Help to keep people out of care that can be supplemented in the home.
Okay, thanks for calling.
You're welcome. Bye.
Bye. Well, that's a lot of callers, and that indicates to me that it's an important issue. And if it's this important, we should have an honest debate. I think Ron, in the last minute, probably put forth as many suggestions as I've heard both parties put forth in the last 3 months. That's the end of the show for this week. Thank you for listening, and we will see you next week.